So yes, have a seat. Also, please come up. Aline Nouzet from Bayer, Grants for Apps. Aline has been running Health 2.0 chapters all over Spain and other parts of Europe, I think, and has now joined the Bayer team, Grants for Apps team. Everybody know what Grants for Apps is? Awesome stuff. Eugene Barakovich, the guy who started this meetup group, actually runs that program now. So he brought Aline in, and Aline is sponsoring this event. So everybody who is enjoying the coffee and what have you, thank Aline, and we appreciate her support. But she also knows a lot about startups. And you know what we're doing right now, right? We're doing the first of 4 pitch contests with some amazing startups. Now, we've been traveling all around the country for last year, and we've been looking for the best startups. So we did Vegas, we did New Orleans, I can't remember anything after Vegas. Philly, Boston, New Orleans, I said that again, but it's worth saying twice. Santa Clara. We've been running pitch contests all over the place. And we've been finding these amazing companies all over the place, and we're bringing them here to New York. So this is kind of like the America's Got Talent of healthcare startups. Why do we do this? Because I don't know if you looked at the logos that Maria had up there, a bunch of those companies came through MedStartr, right? And so our goal is to find companies, early stage companies like Dan Rothman over here from Miami, that are going to be growing exponentially. And I don't know if you remember Dan, he was here last year, he was on stage, and he won the crowd version. He got 2 partners and 3 pilots, and 166 people who had interest in lupus solutions to come. You're going to hear more about this later. But the whole idea is what Maria is saying is generally true about how you get partnerships, but a great other way to get partnerships is also to go on a crowdfunding platform or come to events like this and meet the people in this room. Speaking of which, we had a cancellation for the panel. So Dr. Toyin Ajin from City Block got sick, so she's not here. So is there a doctor in the house? Is there a doctor? Okay, I thought. Okay, is there? Oh, Sid. I'm sorry, I didn't see you there. Come on up, Cindy Wu. Yes, Cheryl Wu, sorry. Cheryl Wu won our physician leader of the year this year. She's a new physician who, not a new physician, but a new member of the Health 2.0, sorry Cheryl, group, and I often do this. I call an audible because oftentimes I want 6 panelists, and people get sick and have car accidents or whatever. So anyway, so it's great to have such a deep bench. So thank you.
Apparently, doctors get sick too, huh?
Yeah. Do you know Toyin? She's amazing. So anyway, so our first. So let's get the rest of the panelists up here. Chris F. I can't even pronounce this. Okay, Chris F. And Toyin couldn't make it. Now this is on page 8 of your book. So on page 8 is the Grand Challenge Finals. This is loosely categorized into pop health, payers, and PHARMATECH, but schedules don't always fit in with what I want actually to happen. And Dave Harlow, where's Dave? Come on up, Dave. So Dave is also a member of the Walking Gallery. Everybody know what the Walking Gallery is? There's a number of these symbols around for people who have been around for a while, like we have, who have been in that early group of scrappy entrepreneurs who create things. And Dave Harlow, also Health Blog, is one of those guys. Everybody grab a clipboard. And also, a lot of you, Ben Berlin has been going around handing out crowd judging forms. And what we're going to do, BZAD over here, is going to enter all the data, and it's going to be part of our final judging. So everybody grab a clipboard. If you need a pen, Ben has pens too. So anyway, so what we want you to do is pay close attention, read the criteria on the bottom of the page, and tell us which ones you guys like best, because you guys are all important too, okay? I mean, we are crowdsourcing in essence, right? So our crowd is made up of amazing folks like you and like them, and we really would like your input. So if you can bring up the MedAux deck. So we met MedAux doing our HIPAA accelerator this year, our first one we ever did. We're doing another one in January. So, we'll be talking a little bit about that later. Basically, it was a week-long program. We were impressed with what they did. And what we really love about MedAux is that they listen. And that they grow and they change. And they've been succeeding since then. They got into the NYU accelerator. Okay, but I'm taking their show. So are you ready? contestant ready? Okay, so you get 10 minutes. Will, over here, Will Treichler. Just incidentally, everybody, this is Will Treichler. Will is our stage manager today, and he'll be moving things around and making decks and things like that. Along with Avishah and Bizad, they are our technical producers that are really make this possible and a lot easier. So, do you have a microphone? No, you can have mine. Do you have your clicker? Okay, good. So I think we're ready. Are you guys ready? Everybody ready? Okay, so Elnaz Sarabchian, is that right? Sarabchian. Elnaz. I'm glad I got Elnaz out right. Anyway, so fantastic entrepreneur, and go for it.
Thank you. Hi, everyone. My name is Elnaz. I'm CEO at MedAux. Our mission is to increase quality of care and reduce readmissions to the hospitals. One big problem in the healthcare system is the rising cost of the patient's readmission within 30 days of discharge. 1 out of 4 Medicare patients is readmitted to the hospitals within 30 days of discharge, which costs more than $41 billion to the healthcare system. According to the data from AHRQ, by empowering patients with education and increasing their self-management skills, we can prevent readmission to the hospital 75%. To provide discharge instructions and patient education materials, doctors use printed materials and verbal conversations. But patients forget 86% of what they learn from their doctors. As a result, 30% of medications are never filled, and 50% of medications are not taken as prescribed. Patients and their families are experiencing preventive medical errors and complications because of inadequate discharge instructions. Via MedAux platform, we are putting patients at the center of care and reduce readmission to the hospitals. We provide doctors a library of interactive patient education videos, lesson plans, and checklists. The platform is powered by artificial intelligence that matches the best materials with the patient's age, diagnosis, and language. Doctors can automate the delivery of materials as soon as the patient is out of hospitals. They can track the delivery, view of the patient's materials, discharge instructions, and videos. In case the patient requires additional support, they can communicate with the healthcare team via our HIPAA-compliant messaging. All features are managed by both doctors and nurses, so there is no burden on the doctor's busy schedule. Doctors can make follow-up campaigns and send daily notifications on taking vital medications, and this way they are increasing adherence to the treatment. There are different players in the field that they're trying to solve part of the problem. Our value proposition is the artificial intelligence sending personalized patient education materials and follow-up campaigns and identify patients' actions in real time and quantify costs for all payers. We piloted the platform with 300 asthmatic patients. We assigned them to treatment and control group, and we reduced readmission 33% within 2 months. Our business model is simple. We charge annual subscription fee. We are targeting district programs' $32 billion fund, and we are in the process of integrating to 3 performance provider services with more than 56 asthma and diabetic departments. Our next market is pharmaceutical companies providing targeted marketing. Our team is comprised of a physician, Dr. Behzad Jazairi, who is also a research award winner. Our CTO, Ali Alavi, is a PhD in computer science, and I'm a doctorate in educational technology. We are alumni of Venture Out and NYU Started program, and we have been featured in different medias. We are looking for partners hospitals, and research centers. And please vote for us at MedMo17. You know where to find me. Just send me an email, and we will have a meeting. Thanks for your attention.
That's great. So now we have 5 minutes of Q&A. The judges get first questions, but we will have time if you run out of mic. Questions, please raise your hand, and we will come and please tell them your question, and then we will. So if you're ready, we've got 5 minutes going.
So I'm going to say Bessa to come up too.
Yes,
Yeah, come on.
you guys should all have microphones. Sean, please pass them around. You get the mic, so. Okay, go ahead. 5 minutes.
So it's not clear to me what the product actually is, and then if you could just describe that, and also how is it actually implemented? Because what you're doing is you're putting something in the hands of patients. So how are you going to get it in their hands? Who controls it? Who has access to it?
So the platform gets integrated to EHR of the hospitals. So as soon as the patient is out of hospitals, they get packages of the discharge instructions and the educational materials. So there is no burden on the doctors, any extra workload. We are selling to the hospitals, and the patients are the ones who are increasing their self-management skills and empowering with the education. So this way we are making sure that the patients are aware of all the preventive strategies.
But is it delivered all through messaging? Is it web-based? How does the actual, because your whole premise is if you can get patients to get more information, they're going to follow instructions, better clinical outcomes. But how does the patient interact with your?
So we are sending the materials via SMS, email, and mobile app. The SMS and email is for the medical community who is educationally and technology related limited. So in case they don't have a smartphone, they get the materials via SMS and email. But if they download the app, they are going to get all the campaigns and the materials via our mobile app.
Thank you.
I have a question. So like Maria said, clinicians are really into clinical proof. So I have two questions. One is, do you have any data on how often patients actually utilize such tools?
Exactly. So based on our phase pilot study, the average time spent on the platform is 25 minutes per month. So the patients are opening the materials, they are reading them, and also we can track how many of the materials are viewed and also how much of the video the patients are watching.
But in the world of data, had there been any studies looking at patients who do engage with, say, videos or some sort of engagement with the platform and the reduction in readmission rate, right? Because that's the first question we had to answer, right? Like, does doing what you guys are selling actually reduce the problem? Okay. Is there data on that, or, prior to,
Yeah. So to answer your question, if you go and look at the literature, there are multiple studies there that shows even simple SMS, not even interacting with patients, just sending simple SMS to the patients can not only decrease the readmission rates, but can also increase the survival of cancer patients, just having communication.
How?
How is with having be proactively contacting with the patients before them experiencing a real-world complication, for you to get the information while there is no acute accident for the patients, to act proactively. That's the solution.
so reminders to take their medication, or?
Not the reminders to take the medication. Take the data from the patient and act proactively. Let's say you are a cancer patient, you get chemotherapy. Okay, so one of the main complications is to have a complicated infection. So once you have the first sign of infections, let's say a fever, and you can act fast before that fever goes and turns into a septicemia. That's all the thing.
So the patient's actually texting from their phone, I have a fever now.
Not even texting. They ask the questions, okay, now you had chemotherapy. Have you felt that you have a fever or no?
So within 24 hours of receiving chemotherapy, there's this SMS that goes to their phone. That's a bot. Do you have a fever currently? Take your temperature.
With a yes or no answer. So
Okay.
it's just a click that yes or no.
That was for that study, if you're asking.
So thank you so much for that. That's very good to know. One of the problems, as you guys know, is actually getting patients to do stuff. When they bring home that discharge summary, they don't read it. They don't ever look at it. They bring it to their doctors. So it's actually, I think it's the interaction between human beings, even if it's a fake human like a bot. The second question I have for you is, out of the patients who have used the 25 minutes per month, have you guys been able to kind of get any sort of data or change or effect of those 25 minutes?
What do you mean?
If they used it for 25 minutes, it's actually reduced the readmission rate. Yeah.
Percent readmission rates, yes.
By how much would you say?
So regarding the fact that these patients had multiple readmission to the hospital, we assigned them to treatment and control group. Okay. And we see that in the treatment group, the readmission to the hospital within 2 months has reduced 33% in comparison to the control group.
Do you think it's because they actually go back to see their doctors more? Did you guys control for that as well, or?
So the variables coming to this, result is not only one or two, but a package of providing the discharge instruction, education that leads to the self-management, and at the same time being in contact with the healthcare team when they need the required support and response.
So the question is whether I'm sorry.
Dr. Wu? Sorry. Okay, so that is the 10 minutes allotted for this particular team. It is a competition. We did give them a little extra time because they got a lot of other talk that was part of the question. So thank you. If you like these guys, what's the Twitter handle?
So ask MedAux.
Ask MedAux, AskMedAux. Thank you, Elnaz and Bizad. Really great job. Let's get a big round of applause. So it is a competition, so we got to be fair. So everybody only gets 10 minutes, and we have to be able to get through this whole thing in a reasonable amount of time. So I'm sorry to cut people off. Also, for the judges, make sure that your questions are concise. That you're cutting into their time. Everybody only gets 10 minutes. So, and that also goes for any questions from the crowd. They have to be very quick questions. Okay, so part of our San Diego trip, we met Ashok and his team, and really were impressed. It's nice to meet you in real life. Sharad Mishra, my partner out in San Diego, ran that event, really did a great job, and it was very exciting to find people from all over the place doing amazing things. So without further ado, timer, are you ready? Will, okay. Will's going to put up 2 minutes when you have 2 minutes, 1 minute when you have 1 minute, and then like this when you're done, okay? So, so he gets 2 5-minute blocks. Okay, so judges ready? Okay, so if anybody out in the crowd who has these forms, if you want to share your thoughts with the entrepreneurs, you can either go on MedStartr.com and find their project. There's a search box at the top, or you can go to the page of all the showcases, or you can write it on these little pieces of paper, because I know we're in healthcare, we all still like paper, right? Anyway, so we would love to have your feedback, and we'll pass it on to them if you want us to. Okay, so Ashok, you can take it away.
Great, thank you, Alex. Perfect. So it was a pleasure to meet Alex, albeit through email, and Sharad in San Diego. It was an honor to be selected to present here, so thank you for your time, and I look forward to sharing Cellanyx. I'm the technical founder and CEO of Cellanyx, and we asked the question, why are diagnostics being done with dead or fixed cells rather than live cells? Given the advances in research and given the advances in our understanding of biology, it seems to me that, or seems to our team at least, that there's a lot of data to be extracted from live cells and instead of just fixed cells, given that biology is dynamic and given that disease is complex. So after asking that question, we tested our hypothesis. And so actually it's been 80 or 100 years since we've been doing diagnostics, looking at fixed cells, and these are static biomarkers, which only provide so much accuracy, and it's just above clinical noise, just around 75%. And if you think about that, you're a patient, you walk into a doctor's office, and the current tools are only available And the current tools only allow for 1 or maybe even 2 out of 5 patients getting the proper diagnosis and proper treatment. So think about that. You might be 1 out of 2 or 1 out of 5 or 2 out of 5 patients. Those are below C average odds if you have a child in school. That's theoretically unacceptable. So what we've done is push that up by actually providing live cell diagnostics. To give you an intuitive sense of what's going on, here's a picture of my daughter, and we have a snapshot and a video. And if you look at the video, while the snapshot looks quite fun, the video turns south a little bit. And this is the power of spatial temporal resolution. You know, this is a very happy scenario, but then it gets kind of, you get a headache. So this is what we actually look at. This is what the test actually does. We have machine vision, we have machine learning, and we kind of look at the cells and actually measure their dynamics and the biomarkers. It's an automated platform. Again, it leverages machine vision and machine learning. As a product, it could be rolled out as an R&D tool for pharmaceuticals to better understand biomarker development, lead compound generation, as well as a diagnostic tool. It'll be rolled out as a CLIA or lab-developed test. So it's a service, essentially. And the scientists that we talk to, our collaborators at Cleveland Clinic and Harvard, are excited about our ability to drill into single-cell dynamics when we're talking about discerning between the different types of cancers. Our strategic partners are very excited about the breadth of which we can actually attain and tackle with respect to not just within oncology, but in different indications. Our technology is well protected. We've got patents granted. We have Nature publications published. Again, the technology is scalable and predictive. We've got a number of opportunities in the pipeline in terms of strategic partnerships from a pharmaceutical standpoint. We have a first-in-class technology. We're the only company that we know of that does live cells and machine learning. We have, from a clinical standpoint, we have a tremendous body of data, clinical data that has been presented at the AUA, American Urological Association, as well as other conferences, again, peer-reviewed, which supports that it performs better than genomics, better than histopathology, and it fits seamlessly within the workflow, and it's complementary to what clinicians are using today. Again, this is kind of our comparison with the actual product competitive landscape. Depending on who you talk to, we outperform or annihilate our competition in terms of performance. And our commercialization
Okay, so
strategy
that's your 5 minutes, and you will be cut off at 5 minutes, as indicated. So you will get a chance to try to answer those questions. So timer, we have 5 minutes. And incidentally, as a ex-pathology PhD student and teacher of pathology, I think this is awesome, but because I can't see, so I'd love to have a machine do it for me. Anyway, so judges, try to ask one question each, and come on in.
So I'm interested in understanding better the power of the research, the volume of the data points that you're looking at in yielding your publications.
Sure. So there's about 15,000 cells in the biopsy core. We look at roughly around 5,000 of those cells. It takes about us 3 days to analyze a sample. It takes on the microscope, it takes about 5 hours. But then that's compared to genomics, which takes about 14 days, and histopathology, it takes about 7 days.
Right. My question is really about when you're comparing cases and looking at the power of the tool. Are you looking at 20 cases, 100 cases, 10,000 cases?
Oh, no. So we've done this in over 500 patients. This data that is public, we presented at the American Urological Association in 2016, is 238 patients.
Real fast, can you hear me?
Yep.
Just like revenue model.
Yeah, thank you. So we're gonna license this. We're gonna be a small shop. We're gonna be super lean. We're gonna clinically validate tools and license it to partners that can commercialize it for ourselves. So we've got a pipeline here that's clinical validation in prostate cancer, close to clinical validation in breast cancer. We've got other things in the pipeline. We've raised 1.5 million. We're raising another 3 to 6 to finish the prostate, to get that to licensing, to also do a couple tools. And then we anticipate roughly around 50 million in licensing for the next 3 years, but that's just within the prostate space. And we've, like I said, we have other indications.
And that's how you're stacking this, is based on, you know.
Right. We're structured as an LLC, so we're going to drop down subs to then sell off and kind of protect our early investors, and then also build long-term value to make sure that we can actually apply this technology, not just even in oncology, but in fibrotic diseases as well.
What's the next, like, what's the one behind, like, prostate?
Breast cancer.
Sorry?
Breast cancer.
Got it.
DCIS, ductal carcinoma in situ.
I've got a quick question. Can you just say, you say it fits within the workflow. Talk a little bit more about that. Like what is, because I'm not a scientist, to do live versus static, like what does that mean? Does that mean it has to be done in the doctor's office? It has to be done within a certain amount of time? Like what does that actually mean?
Right, so needle biopsy happens. Currently they kind of pop the needle biopsy in PFA, which sometimes is in a urine cup, which we're all familiar with. And then instead of doing that, they pop the biopsy in media. And they give us one biopsy, as opposed, at least in the case of prostate, they'll give 6 to 12. And so we get one biopsy, it gets put in a box with ice, sent to our lab. We process it within 3 days and return the results. So the patient doesn't experience anything different, the doctor doesn't do anything different, with the exception of taking perhaps an extra biopsy, which they're already taking 6 to 12.
Are you going to have labs throughout the country? That's one of the biggest problems with.
Well, that depends on our partner. Yeah, that depends on our partner. We can service, because we're doing a live cell test, we've been sure to ensure that we can process samples up to 72 hours, so we can do one lab across the globe if we wanted to.
How do you get the actual thing though, right? Like
FedEx, UPS.
Okay.
Yeah,
So you're going to
just-
rely on UPS.
Right, yeah, DHL. Yeah.
Can you expand a bit on the role of machine learning in your solution?
Yeah, so that's really fun. As the inventor, I was sure that I knew the answer to it, but my team made sure that we employed machine learning, and so I am humbled by the advances that machine learning has provided us, in as much as we take roughly around 500 biomarkers, and then the machine learning will rank each of those biomarkers accordingly to what we want to predict. So for breast cancer is different, for prostate cancer is different, for seminal vesicle invasion is different, for extranodal extension is different, and it's a decision tree. It kind of it protects for overfitting. So it just ranks the biomarkers and then gives a prediction. And then you've seen some of the data that shares that it's in, when we combine two algorithms, we can get 98% accuracy, which is better than 75.
Which is a great point to finish on. Which is a great point to finish on. Clinical significance is important. Thank you, Ashok. Great job. Tweet with the hashtag MedMo17. Cellanyx, which is CELLANYX, if you're not looking at page 8 of your program. Judges, please record your thoughts, and let's queue up health costs. We met health costs in Las Vegas this year. They won the pitch contest there. So what you're seeing here is the best of the best from around the country. We love New York, but we knew that we had to get out of New York if we wanted to find more amazing investments where all of them would be growing exponentially. So you guys are going to help us choose the next ones today. So I thank you all for your input. That's the real reason you're here. That's why the tickets are so cheap. So not just because Bayer is sponsoring, but because we have an ulterior motive, which is we want to pick all of your brains. Because I know there are amazing people in the audience. Like Rich Golden from Amwins out there. I mean, it's great to have you here. He does a huge amount of work in finding innovative companies and working with them. So when he likes a company, we listen very closely. And the same is true for all of our judges. Okay, so are you ready?
I'm ready.
You are ready. You're always ready. Okay, so Naveen Goel, take it away. You got 5 minutes. Is he ready? Okay, and as you saw, we'll be cutting people off at 5 minutes.
Thank you, Alex. Good morning. I'm Dr. Goel, and practicing physicians. I was trained here, right, like 5 miles from here, back to be home. It feels good. So being practicing for almost 12 years and 25 years in healthcare, the biggest problem we have is I cannot figure out what my patient is doing when he leaves my office. No idea. I can order a Domino's pizza and I can track when it is ordered, baked, getting ready, in the box, and is being delivered to you, now delivered. Can I do it to my patient? No, that's not the answer. That brings to health costs. It is a physician-sponsored mobile patient engagement platform to improve the quality and decrease cost of care. Why? Because whole healthcare is changing to value-based care. Now why health costs? Because we connected the patient engagement to the quality metrics. That is the value-based care, all in one place. Market size, everybody knows 52 to 55 million patients, Medicare. We are already live and it is going well, so they want us to implement to their 100,000 patients in next 12 to 15 months. It is designed by doctors and leaders in the industry. We believe in it so much that we funded ourselves for more than $1 million. This is our financial, very simple format. In 3 years, we're looking for decent, with even 5% market penetration, significant numbers. Let's get started. So as we talked, there's a great information vacuum. There are hundreds of EMRs, medical records, scheduling, billing, patient engagement platforms, and portals, analytics company. The problem, nobody talks to each other. So much technology, 200,000 app out there and 20 apps per day in healthcare, no idea as a physician which one I should take, as a patient, no idea which one I should take. It is actually creating more problem than solving the problem. It is not only costly in vacuum because it is costly, leading to unnecessary hospitalizations, medical errors, and repetitive testing. It has a cost to it, a lot of cost, which can be preventable. People talked about it, 40% reduction in this cost will be significant amount of money. Solution, something which connects, not compete, but connects all these points. That is health cost. That's what we're introducing. Which brings to the point, bringing it all together, whether all the technology algorithms together in one place to manage one patient. As a physician, I'm not going to look at 20 different platforms to manage a patient. I need everything in one place, and rather in one place connected, so I have to do less. I do not have time to manage patient if I'm going to do that many platforms. Same thing with the patient. That brings to the point of competition. Verticals. I can talk about there is no dominant player in the market yet. There are different remote monitoring platforms, patient management platform, medication management platform, but they're all in remote areas. As the previous speaker, they're all in silos. Again, who's going to connect all that? That is health costs, which is a single app which has pretty much all the, is an app sponsored by the physician, so patient can download on Android device or iOS phone, and it is connected to the patient, doctor, and the patient also has the ability to input the data, so it has multiple partners taking care of it. It is connected through a health score. If I ask you how healthy you are, what is your health score, you probably don't know. If I ask you when you had your last tetanus shot, I don't know how many people can tell me when they had a last tetanus shot. 1, 2, 3, 4. So you're a physician, you better know. So this system automatically, patient reminds the patient, hey, you are now 50-year-old, you need a colonoscopy. You are now turning 40 as a woman, you need a mammogram. So it's an automated system which reminds the patient. So we kind of shifting the burden of care from only from the physician to the patient as well. He cannot come and say, hey, I was not knowing that I had a colonoscopy needs to be done. No, it was reminded to you on the time, and you had the ability to call the physician to get that done. That's one. So not only that, we are giving the ability to the physician to reach to the population. In my office, it takes months to figure out which patients did not get mammogram, and then get them sending the first mail, and then trying to get to them. It takes months. With 5 clicks of button, I can reach to that population and close my care gaps. If people understand care gaps and quality metrics, that's what it is. Not only that, we can do the medication management. Where patients are told what medication needs to be taken and tracked. Not only if the medication is changed at certain point.
Excuse me, doctor. You're out of time? Okay. So, I would want to do that. If we can't have fun. Anyway, so, now, I need you guys to give them a really hard time, okay? So, I want to hear some tough questions. And I want to hear everybody ask at least one question. Okay, so make them quick. 5 minutes, go.
EMRs, right?
And always use a mic so the internet can hear you, because the internet is listening.
Right. Hello, Internet. I have a question. EMRs, right? One patient can have multiple medical records and multiple different EMRs. How do you propose to integrate all that?
So that's the future. We have to start from very basics. So we have to start from the primary care first. So we have to connect the primary care to the patient first. And once that is taken care, because in the end, who's the gatekeeper of the whole healthcare is supposed to be primary care. So primary care will have the ability to control this platform, because everything is being communicated to the primary care. And then in the second and subsequent phases, when we start connecting to multiple EMRs, those specialists, all the changes made will be automatically converted into this. If you read healthit.gov and look at their videos, this is a consumer mediated exchange which we built. Everything in one place, whether it's appointment, telemedicine, analytics, self-monitoring, remote monitoring, medication management, everything in one place.
Okay.
How do you engage the healthcare professional? And does it suppose extra workload for them?
No, so once we started connecting to the EHRs, it is all automated process. So it's take the information from the EHR, it moves and move forward. As we discussed before, that is the most painful point. So we have different way of connecting to the EHR or taking the data, because we are going to the quality-based care organizations. They have their own data. You really don't have to go to the EHR. They can give the data, start the platform. Anything changes, automatically changes the stuff in the background. But if the physician is very involved and he's got enough staff, they have the ability to go and change whatever they want to change. They want to create the alerts and change the right away, they can do that too. So it's a multi-faceted way of putting the information inside.
So there are products in the marketplace that do what you're talking about, at least on the provider side. And so I'm going to ask what is maybe a heretical question for this crowd. Do you have evidence that bringing the patient into the picture helps clinically?
So we are started to see that. We have a couple of 100 patients working on it, and they're loving it. So we are seeing the engagement side of it and what they bring to the table. To the point that the organization we started working on it, they already asked us to implement it in their 100,000 patients. So they are seeing that response. Do we have the number right now? Because we started implementing 2 months ago. So numbers next time probably, but we have the, they'll go how to next 100,000 patients are theirs. So they are seeing what we can do for them.
I have a quick question on just sort of like on the a revenue model. And I missed that page that you had, but I would imagine as a physician, I mean, it's going to diminish the amount of like administrative time you need. Hence,
Absolutely.
Like, make you more
months of
profitable,
times they
right?
take reaching out to the population or managing it all. Absolutely.
Right. So, I mean, as far as like the scalability, I mean, I see that as, the ability for a physician to just increase patient load because you have less administrative costs. I mean, is that?
That's one of the value-based we are providing to them, that your administrative time should go down as we start moving forward more and more. Initially, yes, everybody has to do a little bit more, but then eventually the months of time which I spend trying to track the patient in terms of medication, on closing my care gaps, that's a long haul we have to go through, which is like 5 clicks and you're done.
And as far as the money, like how do you make money with this?
So it's PMPM model.
Got it.
So like the whole health industry, same way.
So should I tell them to stand where that chair is?
Thank you.
Okay, so are we out of time? Okay, so 1 more minute. So are there more questions? Okay. You can't ask. You're in a competition. Okay, go ahead, Larry. Lawrence Lynn.
Do you belong to a hospital setting? Do you belong to a private setting? Because what you're describing may be provided by either one of those.
So this is a very green platform. So it can connect anybody. We are going after the high-risk groups, Medicare Advantage patients. So that we are starting with the private care settings. But we can have the same remote monitoring capability, and after the patient gets discharged, the same product can be used by the hospital to prevent the readmissions. So it's a multi-purpose platform based upon your workflow and what you're trying to achieve. The bottom line is if you do not bring the patient in the picture as a complete, we can do as much as analytics, we can do all cancer. If you do not connect to the patient, we cannot get to the value-based care and provide a quality care, because providing quality care is to the patient. That answers your question? So it's both. So we are going starting with. I'm practicing too. Yes, I am.
No, he means where are you practicing? In a hospital or?
I'm outpatient.
Okay, great. So thank you. Great job, Dr. Goel. Let's give a round of applause. Once again, he's Health Costs, HEALTHKOS. Please tweet with @HealthCosts to vote for Health Costs. Okay, so this is a really difficult competition, right? Because 3 out of 5 of the teams have already won in Vegas. And once again, I can't remember anything other than Vegas. Vegas, New York, and Cellanyx won in San Diego. Thank you, New Orleans as well. So coming up is Valisher by David Light, who you may recognize as a child star. No, okay, we're not going to go into that. It's true though. But also he has a really amazing startup, and he's doing a great job with it, and he's getting great traction. So if his 5 minutes are ready to be started, they start now.
All right, thank you very much. So I'm going to talk to you today about Valisher, which is a novel online pharmacy that will be the first in the world to dispense a chemically validated medication. Now, you hear about it in the news all the time. I mean, it's really front page news quite often. The problems with counterfeit medications, with medication quality. A news event concerning quality medication happens 150 times a year. And it's not just about the global supply chain. I mean, even generics, 90% of the drugs in the United States are generics that people are taking. Okay. And over 80% of those are being produced in India and China. So it does sound like there's some cause for concern. However, you know, there's certainly a perception of this general problem, but what about the reality of it? What about the data? What's really going on? And there's plenty out there, but I think what really underscores it best is the story of how Valisher got started. So a good friend of mine, Adam, we're buddies at Yale together, and he's on an anti-epileptic medication, obviously very important for your health. And he's been on it for a long time, and every once in a while he goes to refill his medications, he feels terrible that month. He gets all sorts of side effects, he gets relapses sometimes, and after a particularly bad episode, he called me up, technology development buddy, and was telling me all these various issues. And I have to admit, I was a little skeptical. I mean, like I don't take any prescription medications yet. And I was like, well, you know, where's the data? What's really going on here? Did he just get some weird bad batches and the FDA just take care of all these things? And when I started looking at the data, it was pretty eye-opening that, especially in anti-epileptic medications, there's a lot of studies out there, not just looking at the problems between brand and generic, but there's even a Harvard Medical School study with almost 2,000 patients that showed simply the act of refilling the medication. So the lot-to-lot variability inherent to the medication was associated with an over 2-fold increased chance of getting a seizure. So very clear, I mean, the data's there, and obviously your epileptic medication's made the same way as your Zoloft or any other medication that's out there. So our solution to this was not just more visibility and more news articles, but to actually solve the problem by developing analytics that we could apply to chemically validate the medications where it matters most, at the very end of the supply chain. Lots of people talking about trying to fix this $3 trillion pharmaceutical supply chain, but the real solution is to come in at the very end, analyze it, and only distribute what is of the highest quality medications to our consumers, which will come not just with our brand, hey, we stand for quality, but we will give a certificate of analysis using our proprietary laser-based analytics that tells you all the most important things you'd want to know about your medication. Active ingredients, inactive ingredients, even how it dissolves in your body, which is one of the major issues that come about when the FDA actually pulls a drug. And here's just an interesting example of that. Really, right as we were validating our technology, we took 4 batches of Motrin from CVS, Walgreens. 3 of them dissolved in 15 minutes, as they usually do. 1 of them took over 9 hours to dissolve. You're practically pooping it out before you're getting any usefulness out of this pill. And this is honestly tip of the iceberg of the stuff that we find. So what are we going to do as a business? We are focusing, so we're planning to launch with about 200 drug products, mostly prescription drugs, that we will chemically validate before we distribute. Those are market research driven. We did lots of market research, Google Consumer Analytics with serious marketing partners to find which markets people already have the most problems with. And one of the biggest ones of those was the antidepressant market. A lot of people reporting a lot of issues with their medications, and it's a massive market. 15% of Americans take an antidepressant. So we'll be hitting those markets and a few others. And path forward, so myself and Adam, we put in $250,000 apiece just to build the technology. So we have a fully functional laser-based analytical system that we filed the patents with Wilson Sonsini. It's ISO 17025 accredited, which is the highest level of accreditation in the International Standards Organization. And we already did a lot of the market research. We did an angel round of $700,000, which we were oversubscribed for in under 2 months. And now we're actively working on getting to launch. And we need about another $2.5 million in a seed round to do a full-scale launch in roughly mid-next year, which will address those 200 products and, of course, scale from there. And that's beyond the investors. I should also mention we'd love to talk to launch partners, so hospitals, senior living centers, places that want to show that they have the highest quality of care. We have the highest quality of medications. And then lastly, I'll just leave you with, you wouldn't buy a yogurt without a nutrition label. Why would you have any lower quality standards for your life-saving medication? Thanks.
All right. I love somebody who can work to a timeline. That was right to the second. Thank you, David. Definitely media trained. And he's not just a pretty face, he's doing some really cool stuff too. So if you will come over here,
of course.
The best place to stand, I was looking at the camera, and Ivan, how many people are watching? I think the last I saw was like 70 or so. So there's a lot of people watching online, and so I wanted them to be able to see you and our amazing judges at the same time. So anyway, so the 5 minutes will start once Will is back, and ready and go.
I have a question. Thank you so much for that. I love it.
Thank you.
Keeping the pharmaceutical companies honest.
Somebody's got to walk over to the shoulder.
Yeah. So in your science, have you guys looked at the DNA kind of profile of the patient? Because recently there's been a lot of things about, for example, antipsychotic medications, and your friend with the seizure med.
Yeah, so actually it's pharmacogenomics is a very interesting field. My background is in DNA sequencing. We developed the Ion Torrent platform with many others, of course. So that's a great idea for expansion, to actually start taking in a lot of that kind of data and then marrying it with our analytics. But the launch point is, hey, refill your prescriptions at our pharmacy, our online pharmacy, as opposed to Walgreens. It's actually coming with a higher quality that's actually been screened. So we can get there. We can get there.
Make it more democratic. It's okay. Like they can't just. So the other thing is just even antihypertensives. For example, we know as physicians that certain individuals, certain groups, right, races respond better to certain classes. Do you guys even ever take that into consideration or no?
So we're not prescribing, right? So we don't. You make the medical decisions, and we're just making sure that the medication itself is of the highest quality, and further integrations could certainly happen down the road.
Thank you.
Of course.
I didn't recognize you sitting down.
I know you're tall. And then where do you fit in the whole flow? I mean, are you trying to go, are you trying to compete with Walgreens?
These guys won. They won 3 different cities.
Yeah.
That's okay.
Yeah, so I realize that part of the confusing component is that we have an analytical system, but to be very clear, we are the pharmacy, right? So the fact that we have this amazing analysis component is great. That's in kind of the back room. And instead of refilling at Walgreens, you'd refill with us. So our product is whatever you were prescribed, you could refill with us. We're starting off focused on about 200 drug products first. So if you're taking a rare drug, or if you're on a biological drug that we don't carry or can't analyze at this point, then we wouldn't service you.
Okay, so, but why are you doing that as opposed to partnering? Because
So,
you require
great.
marketing dollars to get the consumer as opposed to being the tool.
Yeah, so great question, and that's, I'm also an angel investor. I always think through these business plans. And as soon as we developed the technology, we went and talked to pharma CEOs, we talked to vice president at CVS, we talked to McKesson and all these guys, the whole chain, and the overwhelming response from that entire chain was, yes, we realize there's problems, but it's not our problem. We run a tight business, and people buy our stuff anyway, so we're not interested in spending any extra money on anything that the FDA doesn't force us to do, or that the consumers aren't really forcing us to do. So that's when we realized we really have to start at the consumer level. And the online pharmacy world has been exploding. I mean, even Amazon's talking about getting into it. There's been over 100 million invested just in the last year. So it seemed like the right space to get into to actually make the maximal impact.
Okay, thank you.
Quick question on just like on the pricing. I mean, this is, we're in this space heavily with employers and specialty pharma, brand names. I mean, you know, we used to have like a 1.2 multiplier 20 years ago. It's about a 25.1 multiplier now as far as how the costs have gone through the roof. So how do you fix that part? You know, or how do you play in that part? Generic versus specialty versus brand?
Right. So we leave that up to the rest of the system, right? We will dispense both brand and generic. That'll come through our quality checks.
Yep.
And it's at no additional cost. I should mention that. We're not adding added costs. You don't have to pay more because of getting the extra quality. The cost of our analytics is already extremely low because of our proprietary technology, and we amortize those costs over a batch that we buy from McKesson or whoever the big distributor is. So the other earlier question of how do you fit into the system, we're not reinventing the pharmacy system. We buy from McKesson just like everybody else is going to buy from McKesson or Cardinal Health or the big distributors. We just do our analytics and then dispense to the consumer. And if it's bad, if it's really bad, you actually get a refund for it. And if it's just in the realm where we don't want to dispense it, but it's still legal, which there's big, FDA allows a 45% variability, right, in generics, then we reverse distribute it. So we get a 5% loss in terms of our financials, but 95% of that value comes back to us.
That's one quick follow-up. Just like it's a curiosity thing for me, and my co-founder's wife is an oncology clinician, and there are a lot of meds that we see among commercials that have horrific byproducts as far as causing other cancers, et cetera, et cetera. So, do you find that what you're doing will almost expose some of the marketing practices of what's going on and be able to deliver something way less? That's
absolutely. And by the way, there's a quick point. A unique part of our technology is we can actually analyze and detect isomeric impurities, whereas the industry standard of HPLC is blind to it. So we'll be able to actually see things that the industry can't.
Awesome.
Okay, that was.
I have one comment. You should partner with the physicians and the hospitals because I didn't know.
I would love to.
I know about the lot-to-lot variability, so we're going to be like the annoying voice.
Okay, excellent way to finish. Thank you, David.
Thank you.
Great job. Big round of applause for David Light. From Valisure, VALISURE, for those playing at the online and on the home game. So tweet MedMo17, Valisure, if you really like David's presentation. Okay, so I don't know if you guys know, we ran a HIPAA accelerator this past, I think it was June, July, August? This summer. It was hot. It was great. It was a week, and Erin really impressed us during said accelerator. She's got a lot of great traction in what she's doing, and we think she's got a lot of potential. You have your deck ready, okay? Timer, are we ready? Judges, are you guys all caught up? I see you guys writing furiously. Everybody's ready? You guys having fun? Okay. Okay. So while we have a moment, speak into the mic, everybody. Okay. So the internet doesn't hear you if you don't talk into the mic. So pass the mic around, and keep the question short. Okay. You good?
Thank you.
Okay. Ready? Go.
Sure. So my name's Erin Sykes, and I'm the founder of Mission 360. And all of us here tonight know that health is not just about what you put into your body or the fitness that you do, but it's also about mental health. So what we're doing with Mission 360 is bringing together boutique studio fitness and meditation through boutique studios, as well as one-to-one coaching. And we're delivering it directly to the consumer via video, anywhere, anytime. We're integrating with wearable technology so that you can have measurables and gamification, as well as with hotel and corporate wellness partners. So if you have a flexible schedule, or maybe you have a really crushing schedule one week, you can still get your mental and physical workout in. So the overall market size of health and wellness is about $3.4 trillion. If we break that down into workplace wellness, fitness for mind and body, and healthy eating via coaching, we get a market of $1.1 trillion. And Mission 360 hopes to take about 10% of that market and raise come to $100 million in revenue within the next 5 years. So we currently have launched a product. We have 700 users. 500 of them came through beta. 200 are new within the last 3 months. And then, as you can see here, we have both the desktop and also the mobile application. We have about 40 different studios at present and another 30 different coaches. And we were called the Online ClassPass. So if anybody here is a member of ClassPass, it might be familiar to you, where you can work out at any different studio in New York or LA or Miami or wherever you are for one cost per month. So our cost per month is $35, and at present we've just done B2C. So those 700 subscribers that we have are B2C, $35 a month. Now, as we evolve, the goal is to go into this corporate wellness space as well as hospitality. We have a potential partnership with a developer out in West Hampton to build a physical space that would be under more of a WeWork model. And then also another revenue stream would be going through hotels. So Discovery Land Company is going to be our first hotel partner, and they have 22 different properties throughout the world, and everything is a membership model for them. So it's a super high-end clientele and a really great space for us to be in. As you can see, these are a couple of our revenue sources, and the hotels, the individual coaching, the monthly subscribers, and then as we move on to retreats and wellness. What we've used so far for marketing is a lot of partnerships. So we've partnered with all of these brands thus far, plus a couple others. We just did a full month series at Saks Wellery. We're Bloomingdale's corporate wellness partner, and we also work with a lot of the apparel companies that outfit our instructors for all of their video content. We had some great press at launch. As I mentioned, we were called the Online ClassPass. We've also been called the Netflix of wellness. So we hope to continue to really make an impression in that angle as well. I myself, my background is in corporate marketing. I was with Estee Lauder for 10 years. I'm also a former athlete, so that's where I really pay attention. I believe strongly in the mind-body-spirit connection. Our COO is Nick Masco. Can't even say Mastro Apasqua, and he just joined 2 weeks ago, so I'm super excited to have him, and he was the one that was able to bring us our first corporate partner. So he works for Hearst and also runs all of that corporate wellness partnerships for Hearst. So as we evolve, I'd like to bring the development away from sneakers, as much as I love them, but go in-house. And long short, because I know I only have 5 minutes, is that $850,000 that we're raising would mostly go to that gamification, that amplification of our current platform and our current app, collaborating with some OTT distributors, the corporate wellness partners, adding live stream, because currently we're only on demand, and just fully integrating with our wearable partners, including Fitbit and Wearable X, which is a super cool company. If you haven't noticed them yet, they have a yoga legging that is integrated with sensors and really gives you some cues as to how to improve your process or your practice. So,
Okay, great job, right on time. Fantastic presentation. So, judges, 5 minutes of questions, and of course, the crowd, if you guys have a question, you can raise a hand, and we'll come in and ask you what you got.
How do you ensure the engagement of the users, that they stay active?
Use the mic.
You can hear me? Okay. How do you ensure the engagement of the users and that they come to your app, they stay to your app, and they're just very active on it?
yeah, sure. I mean, I can see exactly who is using each video to, what minute marker. So I can see which videos are the most engaging, give that feedback to the instructors and to the studios to make sure that they're really filming for an at-home user, which is very different than teaching to a group class. And that's one of the reasons why Mission 360 was created, because the studios, they're really good at the experience in the studio, but they don't understand the technology piece. So something's got to give, like something's got to be consolidated in that angle, and that's why we do the video for them.
She's good, right?
I'm curious on the outcomes as far as, and this is on the corporate side, because we have, these models built into large self-funded customers, and, the ROI is puzzling. Like, nobody can prove an ROI with any kind of wellness programs. What they can say is, we make the healthier.
Yeah.
And the sick, or the 550 principle doesn't change. The sick just stay sick and don't do this stuff. So I'm curious on that.
Sure, and that's exactly why Nick came on board, because that's his background. He's in the corporate wellness space. He understands speaking to all of, the different insurance companies and how everybody can benefit from it, not only the user, but also the overall corporation, and also making it flexible. So it's, again, great if you have your Goldman Sachs and you've got a beautiful gym in your office. Not everybody has that. So we have to bring it home and bring it into the hands of that consumer all of the time, corporately or individually.
How many jackets are here, do you know? I think it's like 5 jackets here. Me, you, Dave, Ben.
Thanks for the presentation. As a follow-up to that, so you guys have Bring on Nick. You're going to focus on people with obesity, diabetes, hypertension, cardiovascular disease, stress-induced, chronic inflammatory.
And that is why
you're going through a corporate, but not to attract the patients? Or?
So what we would like to add to the site as it currently is now. So right now we have the video content, that's great, fine. But I really want to add the measurables in so that people can have that feedback via their Fitbit. So it integrates into all of their other efforts, whether it be medically or just personally, to live a healthier lifestyle.
So how do you plan on targeting those customers who aren't already healthy? How do you convert them? That's a real question.
Yeah.
Right? You don't want people who are already healthy, you want.
And I think it's through the data. So once we have those integrations, so we're already working with Wearable X and the yoga leggings, but then with a Fitbit, those companies already understand how to approach that type of customer.
Both open all the time. But anyway, at the end of each contest, then you have 5, so that people can see for the voting.
Anyone else?
Okay.
Okay.
Are there any more questions? Oh, do you have a question? Go ahead, Grace.
Yeah.
Introduce yourself.
Thank you for your presentation. I'm Grace Cordovano. I'm a professional patient advocate. And I'm just curious, when you say coaching, could you clarify that? Is that a mental health specialist, or can you clarify?
It's anything that helps the user own their mission on the whole in a better and more efficient, more productive way. So that can be health coaching, that can be relationship coaching, that can be career coaching. It's really meant to be a holistic platform. So, you look at the Peloton model, awesome, right? You have the bike, you have fitness, you're going to burn calories, you have all the data, but they're not taking into the mental health, not just beyond meditation, because not everybody can jump in and become a meditator. So sometimes you need a little encouragement on that end. So really giving everybody anything that they need to go on this wellness journey at their fingertips.
Okay, any further questions? Okay, well, it has been a very exciting morning with some amazing companies up front today, and I want to thank all of you. Big round of applause for Erin. And her, what's your Twitter handle again? MyMission360, at MyMission360. If you like what Aaron is putting down, then that's exactly what we want to see you tweeting. So we're going to capture all that information as well as all of your forms. So Ben Berlin, put up your hand. Please give all your, so Ben's in the back. So this is just the first of 4 pitch contests, 3 regional winners, 2 great companies from our HIPAA Accelerator. Really impressed with all you guys, really did a fantastic job.